Most of the cases that I am going to present here are from my personal experience unless specified on the slides. Today I am going to talk about the reproductive system. So, I am going to cover both the male and the female reproductive system. Xenobiotic induced effects on the reproductive system can be pivotal in the development of drugs and chemicals, as the human fertility is considered fragile to compromise. The reproductive toxicity is a major source of compound attrition, representing one of the most difficult toxicities to predict or even monitor in humans. The reproductive tissues in both the male and the females are assessed by several evaluations, including record of the weights, the testes and its accessory glands, ovaries and uterus. We also do sperm morphology, motility and concentration evaluations in the male reproductive toxicity studies. We estimate hormones both in male and female and evaluate what is going to be the impact of those changes on fertility. This workshop is for the pathology for toxicologists. Needless to say, the histopathology evaluation is essential for safety assessment and for elucidation of the mechanism of action. Before we venture into any of such assessment, it is very important that both the toxicologists and pathologists know what is the background pathology, what is the knowledge, a good knowledge of the reproductive endocrinology, development and comparative biology, and a lot of species difference that exists, and these becomes very important while doing evaluation. Male reproductive system arises from the Wolffian duct. If you look at the main organ in the male reproductive system is the testis. It is involved in sperm production and also involved in fluid production, which is actually coming from the Sertoli cells within the testis. The transport of the sperms that are formed in the testis is through the retitestis, epididymis and vas deferens. Apart from the transport, they also secrete fluid. The epididymis helps in maturation and the vas deferens in ejaculation. The axis sex glands, they secrete nutrients, they secrete proteolytic enzymes. The secretions from these axis sex gland is important for the copulatory plug formation, which is also essential for maintaining the fertility. The preputial gland secretes pheromones. You see, I mentioned that there are lots of species differences. When it comes to the age at maturity itself, there is so much of difference between the preclinical species. The number of stages in male in spermatogenesis also varies from species to species. The duration of one cycle also varies from species to species. The duration of spermatogenesis, which is different than the duration of cycle, also varies from species to species. I will not go over individual numbers, numbers does not matter. If you look at the accessory sex gland presence in the rat, mouse and rabbit, all of the accessory sex glands are present, whereas in dog it is just the prostate that is present. In man and in monkeys, the prostate, seminal vesicle and bulbourethral glands are present. So, a lot of species differences. It is the association of 4 different types of cells that we see within a seminiferous tubule that characterizes what stage of the seminiferous spermatogenesis that is present in a cross section of the testis, and that varies from species to species. Here are the examples of 4 species, 3 preclinical and human. What is that association? Is the association of the spermatogonial cells that you see over here in the first bottom row, the spermatocytes, the round spermatids and the elongating spermatids. It is distinct association of these 4 types of cells that characterizes which stage it is. So, with this introduction, I will there is one more, that if you look at a cross section of a testis, you would see that this is actually from rat, and it will vary from species to species, that stage 7 tubules, stage 7 is the most frequent stages that you observe in rat, followed by stage 1, and the rest of the 12 other stages vary from something like 2% to 8% in rat. If you look at the morphology, the highest tubule diameter, highest tubule volume, volume of the tubule happens in stage 7 and stage 8, and at that time the epithelium volume is the lowest, and this is because the Sertoli cells, the more active at these 2 stages to support the formation of the mature spermatid, and which eventually is permeated by stage 9. And in fact, in stage 11 is where all of these parameters, the tubule diameter, the lumen of the tubule and the epithelium are the lowest. So, with this introduction, I will not go over, if it is a training program for pathologists, I would have gone over just the spermatogenesis for half an hour staging, but for the toxicologists, I will introduce few and tell the salient features that you need to consider. If you sit with your pathologist, you will understand this. Stage 1, the secondary spermatocytes that are formed from the first meiotic division undergo the second meiotic division to form the step 1 spermatid. It is the presence of the step 1 spermatid which actually gives the staging criteria of a stage 1. So, at this stage you see the presence of spermatogonia, the packetine spermatocytes. The characteristics of the step 1 spermatid is that you only see a very less prominent Golgi apparatus. You can appreciate that here, and the step 15 spermatid from the previous cycle are present as well. And note the size of the packetine spermatocytes. By stage 5, they are increased in size. In fact, differentiating stage 1 to stage 4 is not the easy thing. Even for a well trained pathologist, it is not an easy thing. But by stage 5, the packetine spermatocytes size has increased and a prominent nucleole is seen. But the most important aspect that we consider is the acrosomic system, which is already like a head cap on the nucleus of the step 5 spermatids, and then you see the spermatogonia B type. So, in stage 7, the step 19 spermatids from the previous cycle have already moved towards the lumen, and there is the presence of the large basophilic granule that you see. The characteristics of the acrosomic system is that it is covering 1/3 to sometimes even half of the nucleus of the step 7 spermatid in this case. And you see that the packetine spermatocyte size has further increased. By stage 9, the sperms from the previous cycle have already, there is already a spermiation. You just see one, that's just by a coincidence, and the residual bodies which were associated with these sperms are started to coming down towards the lumen. Eventually, they are going to be taken up by the Sertoli cells and digested. And in the next few stages, you may not see these residual bodies. And you see the presence of leptotene spermatocytes by this time, and the packetine spermatocytes have enlarged much bigger. By stage 11, the packetine spermatocytes are even more bigger with a more condensed chromatin material, and there are hardly any residual bodies except this one, and the leptotene spermatocytes is what you see. The important aspect of this step 11 spermatid is the extension of the acrosomic system almost through the flattened nucleus. The last stage is the step 14b. The second meiotic division happens here, and this is characterized by the clustering of the chromatin material, and fine spindle fibers can also be seen here. And you see the secondary spermatocytes, and sometimes also the step 14 and stage 14 and stage 1 can overlap. These seminiferous tubules, the presence of a single stage of within a seminiferous tubules is common in the rodents, but not so in the higher species. In fact, you see more than one stages within a cross section of a seminiferous tubules in monkey and human here. When it comes to the sperm evaluations, and we do the sperm counts, motility, velocity, movement, morphology using the chorda epididymis, the sperm head count using the one testis. Hormones like the luteinizing hormone, follicle stimulating hormone, inhibin, testosterone and prolactin can be estimated by several methods like the RIA, ELISA, multiplex immunoassay. In fact, the testosterone and its metabolites can be actually very sensitively characterized by the LCMS method as well. I will not go over the mechanism of toxicity because all the toxicologists know much better than the pathologists. What impacts, this is actually from humans, what impacts, what are the sites of the male reproductive toxicity functions that are altered? It could be the sperm production, which is in the testis, not just the germ cells, impact on the Sertoli cells or vasculature or Leydig cells can cause reduction in sperm production. Sperm delivery by the seminal fluid production and ductal damage are the CNS or ANS pathways, which are more more can be assessed in humans than the stress-free laboratory animals, because the scientists like us take care of these animals so well. The sperm quality and the hormonal regulations. Eventually, it can all lead to changes in the histological changes in the reproductive organs. In the testis, as Kalai Selvan mentioned, you can actually, in any system, you can actually generalize what are the histological changes that you see into degenerative, and inflammatory and vascular, in this case Leydig cells. I have few cases from my experience. I will not touch upon the proliferative or neoplastic lesions in my lecture, neither that I understand them so well, nor that that is something that I may not be that important for young toxicologists who are sitting over here. There are fixation and tissue preparation artifacts which are very common. The altered temperature of the testis, the trauma, the testis being forced in and out by an inexperienced technician, the animal technician during the restraint, the impact of the stress. I think few speakers before have touched that upon in detail. I have few case examples here, especially the food restriction by any means. There are a lot of common background lesions that are seen. If you are unlucky, you may see only in the highest group, like an atrophic tubule of 1 to 3, because these tubules have arrangement of up and down and then circular within the testis. So one next to the other, 1 or 2, 3 contracted tubules may be seen, which only have Sertoli cells. Tubular vacuolations, sparse, degeneration of some germ cells, syncytial germ cells, the giant cells, the spermatid retention or delayed spermiation. There can be diffuse germ cell degeneration and depletion, including total tubular atrophy affecting one or both testes if your veterinarian has not selected the right animals and given for the study. Stress response from diet restriction is a very important thing that every one of us have to remember. As the previous speakers mentioned, if the in a dietary study, if the diet is not very palatable, then also such changes are seen. In the test is the first thing that you may see if diet restriction happens for any reason, including the toxicity of the compound on other organs, is the loss of Pachytene spermatocytes. That may if continued, you may also see spermatid retention from the previous cycle. Eventually, if the diet restriction continues for a very long time, then you may see tubular degeneration, atrophy, vacillation, and many other changes that you normally see as a test article related effect. Very important for pathologists and toxicologists to keep in mind whether the body weight changes were there, whether food consumption changes were there. So, with that introduction, the germ cell degeneration is always cell and stage specific when the early event of insult onto the testis happens. It's so well characterized here that the spermatogonia undergoes cytoplasmic eosinophilia, hyalinization, contraction, and nuclear changes, eventually leading to an apoptotic body, whereas in the spermatocytes it is the chromatin condensation that happens. In the round spermatid it is the chromatin marginization which happens as a part of a degeneration, whereas in the elongating spermatid it is the clubbing and the misshapen head formation that happens. Very important for both of us that if at all there is a test article related effect, apart from the stress effect, it is always bilateral, multifocal, diffuse, and in the early stages you would see cell and stage specific changes in the spermatogenesis, that depends on the inciting cause. This germ cell degeneration can also occur as a background change in all of the preclinical species, and it increases with age. This degeneration can be so transient and inconspicuous that the Sertoli cells can actually phagocytize them so fast that within the next 24 hours you may not see those cells. I have few examples. It will be in that case it is only a germ cell depletion that you would see. If you see both degeneration and depletion when there is a continuous administration of the drug, you have to actually call it as degeneration and depletion. There are multiple reasons. Just an androgen deficiency can lead to degeneration, hypoxia, antimitotic agents, pro-apoptotic agent mediators, and cytokine inhibitors. And disturbance in Sertoli cell function also leads. There are some resistant cells, there are some very sensitive cells. The typically even on the spermatogonia, which is which are the stem cells, if the impact is there, they are reversible. Very rarely that there are reports of irreversible impact on the spermatogonia. So, from now onwards, I will I have histological pictures. I will try to train the toxicologist how important to give importance to the details. Here is a case of a Pachytene spermatocyte said except 4 cells, all the other cells are normal. And as I mentioned, it is chromatin condensation, cytoplasmic eosinophilia, and if it could be a crescentic or a full moon halo that forms around these dying cells. When it comes to the round spermatid, it is the chromatin margination that is seen. Only these cells are affected, these appear to be normal, but in some instances we also see chromatin condensation with increased eosinophilia of the cytoplasm. When this continues, these cells can form multinucleated cells. When it comes to the elongated spermatid, it is the clubbing and the misshapen head formation, whereas on this side I have put the normal histological picture of a stage 13 to appreciate the changes here. When it comes to the meiotic cell degeneration, it is the chromatin material is more condensed than normal, and there is cellular eosinophilia. I am sorry for a discolored picture here, and you see that most of the meiotic cells are undergoing degeneration over here. The pattern of germ cell depletion is stage specific depending on the timing of the dosing. Say if you are continuous, like if you are doing a long term study, hypothetically here a packet-in spermatocyte is the one that undergoes germ cell degeneration. When you continuously administer by 4 weeks, you only see Sertoli cells or Sertoli cells and the spermatogonial cells present in the tubule. Rest of all the cells which were supposed to mature from these packet-in spermatocytes are dead. If you give the same compound in a single dose, that packet-in spermatocytes are not going to mature, and you see that there are no elongated spermatids after 4 weeks in this case. Here is an example of a pre-leptotin germ cell depletion. On your right is the normal histology, normal animal histology, whereas here you see that the pre-leptotin spermatocytes which are present over here are completely absent. You see packet-in and the round and elongating spermatids in stage 7 here. There are no reports of leptotin and or zygotin spermatocyte death. The spermatocytes which are involved in DNA synthesis and meiotic division, they are protected by the blood testis barrier, which is an important anatomical, physiological and immunological barrier that forms from the Sertoli cells, which creates that unique microenvironment to protect these which are important for propagation of the species. Here is a germ cell depletion and maturation event. You do not see either the pre-leptotin or the packet-in spermatocytes over here. It is all Sertoli cells and packet-in the round and elongating spermatids here. Do you see anything abnormal here? Yes, it can be a background lesion or a treatment related lesion. You see spermatid, the step 19 spermatids retention in the stage 12. If it is seen beyond stage, it can be seen between stage 8 to stage 12. This is very important, the spermatid retention. It indicates the functional disturbance in the process of spermiation, the abnormalities in the Sertoli cell, the abnormalities in the mature spermatid, and reduction in the testosterone levels cause it. It is important because it actually impacts the fertility, and there are many compounds that are known, including the androgen deficiency, to lead this as a standalone pathological change or in association with several other changes. When this is a normal tubule, when the inciting cause is continuously administered, you may see tubular atrophy and degeneration. The size, the volume of the epithelium and the lumen are all are reduced. Multinucleated cells can be seen in the spermatids in this case, and also a very rare report of spermatocytes also undergoing multinucleated cell formation. When the inciting cause is continuously administered, the disturbance in Sertoli and germ cell intercellular junctions can lead to loss of germ cell adherence to the Sertoli cells, eventually leading to exfoliation of these cells. The same histologically looking normal cells may be also seen in the epididymis in this case. You see that this appears to be a very normal picture, because the spermatogenesis appears to be normal, but I will just magnify that there is Leydig cell atrophy. This typically, if there is a testosterone lowering, you see Leydig cell atrophy and also hypertrophy at the later stages, but it will impact on the spermatogenesis significantly. In this case, it is actually excessive high administration of testosterone which led to this normal looking spermatogenesis, but Leydig cell atrophy. epididymis is a, when the sperms leave testis, they are largely immotile, unable to fertilize the oocytes, but when they come to the chorda epididymis, they become motile, they are able to recognize and also fertilize the oocyte. That is the important function that the epididymis does. It can be categorized into head, body and tail, but if you look at the histological and functional schemes of this epididymis, it can be actually distributed into 6 to 12 distinct zones based on the type and the variety of functions. Like in any other organ, it is the same kind of changes that you would see in toxicity studies.